United Against Cancer.
United Against Cancer.
Hello, everyone. Good morning, good afternoon, good evening. Welcome to this edition after a short break of the United Against Cancer interviews. Today, we're going to be delving into a cancer that affects women greatly across the world. However, is not spoken about as much as the other cancers. I have two special guests that are going to chat with me today to tell us a bit more about ovarian cancer. Our guests are from the World Ovarian Cancer Coalition, which is a fantastic organization that I happen to be one of the ambassadors of, that focuses on ovarian cancer and how it affects women across the world. What more can we do to create awareness and improve outcomes for this dreaded cancer? We're going to be chatting with Clara MacKay, who is the CEO of the coalition, as well as Mikis Euripides, who is one of the directors of a very important study at the coalition that we're going to be chatting about as well today. I hope that we will, through this conversation, reach out to women, to advocates, to policymakers, and most of all, we always say this, the financial organizations, so that we can really amplify the issues around ovarian cancer. Clara is the CEO that comes with over 25 years of experience. So I'm going to ask her to tell us a little bit more about her experience over 25 years, particularly as it relates to the World Ovarian Cancer, her role at the coalition. Over to you, Clara.
Thank you, Dr. Bagudu. So I'm Clara MacKay. I'm CEO of the World Ovarian Cancer Coalition. And as you've said, I've worked in cancer advocacy for many years and in a number of different cancers, including other women's cancers like breast cancer, but also bowel cancer, prostate cancer, and pancreatic cancer. And I have found that each of those cancers brings with it its own challenge. And I feel very honored to have worked in those organizations and for those causes. But the highlight of my career really has been the last 8 years with the World Ovarian Cancer Coalition. And we are an organization that works with a network of about 200 patient advocacy organizations worldwide in well over 50 countries, a very diverse membership. But the thing that brings us together and our kind of common goal is about improving survival and quality of life for anyone at risk of or living with ovarian cancer.
Fantastic. So that's really interesting and laudable, the fact that we speak a lot about partnerships and coalitions, but I personally don't think we have enough. For you to be able to come together with a common goal, pull your strengths together is really very laudable, and I'm very proud to be an ambassador of the coalition. Dr. Mikis, you are the study director. You are a study director at the organization, but would like to know how you're qualified to have this role and what's your other background experience in the spaces. Tell us a bit more about yourself.
Thank you, Dr. Bagudu, and hello, everybody. My name is Mikis Euripides, and I've been working with the coalition for just over 3 years now. I have a background originally as a campaigner, so in the health sector, the broader health sector, initially in the respiratory field of about 20 years as well. But I worked, like Clara, in prostate cancer and also for the UK ovarian cancer charity, Target Ovarian Cancer. And I was also had some time working in industry for MSD, or Merck as they're known, in the US as the patient engagement lead in the UK. So lots of experience of working with clinicians, advocacy groups, regulatory authorities, health economists, and others. And as you pointed out, the study director for this excellent new burden study looking at ovarian cancer.
Okay, that's great. So let's go a bit more into the work now. The coalition, this is an important time for us to have this conversation. We've just come out of the Women's Health Month, and we're heading towards World Ovarian Cancer Day, which is on the 8th of May. So we're bang in the middle, and we can really highlight these two issues that are very closely related. The World Ovarian Cancer Coalition is an organization of like minds that comes together to ensure that every woman, no matter where she lives, has an equal chance of survival and navigating ovarian cancer. There must be some key initiatives and partnerships that have enabled you, or that the organization has come together to amplify and to work on, so that we can reduce these global inequities that you can tell us a bit more about when it comes to ovarian cancer. Let's start with you, Clara.
Yes, thank you so much. So a couple of things do come to mind. You mentioned World Ovarian Cancer Day, and that is an incredibly important kind of milestone in our annual diary. And that's a day where everyone can come together around that commitment about improving survival and quality of life. And it's a nice one because we speak directly to women about symptoms and risks, but we also speak to policymakers and healthcare systems about the importance of doing more and better. So it is a genuinely global and very impactful day, very important day for us. In terms of the second initiative that I think really speaks to the heart of how we work and why we work and who we work with and the impact of that work, I would say our Every Woman Study LMIC edition that we're just completing at the analysis of the data from. But I think that really speaks to the power of collaboration and partnership. So the World Ovarian Cancer Coalition has undertaken this study in partnership with the International Gynecologic Cancer Society. So they are a global membership organizations for clinicians. We are a global advocacy organization with a significant reach in terms of advocates and organizations. And so together we were able to bring the clinicians, the patients, the patient advocates, advocacy organizations, policymakers, global agency, cancer agency individuals to come together and oversee a study that was implemented in 22 LMIC countries, including Nigeria. And I think the beauty of this study is that the study was designed with kind of a sense of global cancer landscape and what that looked like and what we needed to tackle. We were very mindful that there was very, very little evidence about the ovarian cancer patient experience in LMIC countries. We felt that was a very laudable initiative to come together around. We worked, when we implemented the study, very closely at country level. The study was led by clinicians and advocates on the ground. So we were able to collect responses from 2,500 women living with a diagnosis of ovarian cancer in 22 LMIC countries, with, close to 100 clinicians working in those countries. The data that's coming out informs our global policy agenda, but most importantly, it is informing advocacy priorities and work at country level. And Nigeria is a wonderful example, as already moving forward with the second phase of that study, which is really just sitting around a table with those key stakeholders and looking at the issues that were identified in the study in terms of, practical things like transport challenges, more fundamental challenges around access and the financial impact of the disease, the challenges that healthcare professionals are facing when they do their best to provide the best care. So it takes it from a global framework the implementation very much at national
Levels.
involvement of patients all the way through the process, and then with a very, very kind of specific focus on, now that we have this data, how can we use it to inform our plans nationally? And Nigeria is moving forward with an amazing pilot project that will be doing just that. And I think it's a great case study just of how people can come together with those different interests and genuinely, generate data and insight that will lead to very practical change at country level.
Very, very interesting, and really great to hear that you were able to pull these countries together in two separate studies, as well as working with another organization, the International Gynecological Society, so those trends and the scientists, the researchers involved, it must have taken a lot of logistics and, meetings and finances. We talk about the funding for the ailment, ovarian cancer in this case, but to be able to come up with that kind of study needs also a lot of resources in terms of the human resources, the financial resources that needs to be put into it. As the study director, Mikis, what can you tell us about the design of a study when it comes to working in LMICs? And you in the North have this ability, or you're used to having such studies, and there are trials that go on with reasonable funding. We are now facing a global crisis when it comes to funding healthcare globally. And what can you tell us about how you put it together, how the success was, what were the barriers, and maybe a little advice on how we can move forward in the current climate? Over to you, Miki.
Thank you. So for the socioeconomic burden study, and obviously we did leverage the data from both editions of the Every Woman study, so the high income edition from 2018 and the ongoing or almost complete, close to publication of the LMIC version. So as Clara mentioned, that covered 22 LMIC countries. So when you're doing a study like this that has a mix of high income countries, middle and low income countries, what becomes very apparent very quickly is the fact that the data sources for high income countries and some middle income countries are a lot more readily available. So you've got information that you can access, online databases. And this study, the socioeconomic burden study, was a mix of a kind of a thorough literature review, looking at databases, and then it, as I said, kind of tied into the Every Woman study, where you're actually involving kind of interviews with clinicians and patients. But, you can access a lot of information, whereas when you're looking at the lower middle income countries, that information just isn't available. So you're essentially relying quite heavily on studies like the Every Woman study. You are relying to an extent on information that the WHO perhaps has created. So databases, when they've looked at studies when it comes to the costs of various things. And obviously this study was placing a cost and a value on a whole load of inputs, to get that kind of socio-economic burden study. So that was always the big challenge. And I know that is a challenge for many studies of this nature. If I can just give you just one other example, we talk quite a lot about the value of genetic testing for when it comes to potentially trying to prevent ovarian cancer. If you look at Nigeria, which was one of the 11 countries in the study, the burden, if you like, for genetic testing is a lot smaller, but that tells you a story that really genetic testing it is barely, recognized in Nigeria, right? So, and I think the cost that we identified for Nigeria was under $5,000. So if you think about that, that is the amount of money that is spent for the whole of Nigeria on genetic testing for ovarian cancer. It's a minuscule amount. So although the burden is less when it comes to that, it also tells you that genetic testing just isn't looked at in many low-income countries.
That's really so. You think that with genetic testing we can do better with ovarian cancer and other cancers? That is something that we need to look at and highlight as well. So what are the strategies that we can effectively implement to support the genetic aspect of it, especially to make it more population based and address how do we in low resource settings address these challenges?
Yes.
Well, I'm sorry, Clara. Go. No, please go.
I was just going to say it's probably covering the same territory, Mikis, but I think, it cuts across a number of different areas of action. And I think firstly, as Mikis just spoke to, kind of identifying the extent to which there is genetic testing available or happening, that gives you a baseline and a benchmark. Then I think it really is about firstly thinking about those kind of policy interventions that you need. So identifying genetic testing as part of cancer control planning and its value, understanding the impact and quantifying that impact in terms of lives saved, potentially, not just from ovarian cancer, but from other cancers that have genetic links to ovarian cancer mutations. I think it's about, I think a starting point is really about the risk, identifying the high risk population. So really prioritizing where there is strong family history and starting there. There is a need to really, so the barriers are often about cost. And so real need, I think, for healthcare systems and policymakers to think about the reimbursement or universal healthcare coverage for genetic testing. And then there are things about, levels of awareness. So raising awareness of basically the importance of genetic testing and the impact that it can have. Also really having to think, and this is nationally, about kind of the legal and ethical and social kind of work. Yeah, exactly. So there are a number of kind of key areas that can be tackled and need to be kind of tackled systematically. But I think that's the starting point. Mikis, feel free to add to that.
No, I think you covered everything. I was just going to add that we also had the coalition, that is, had a roundtable discussion on prevention agenda, particularly kind of how genetic testing can address that in ovarian cancer. And we undertook a little bit of desk research ahead of that roundtable. And one of the things that struck me when I was looking at it was just the so few studies that have been conducted that look up, examine the genetic challenges when it comes to specifically this study that I looked at was specifically around Black Africans. It was just, I think it was less than 1/3 of all the studies that have been looked at, that have been published, actually looked at that population group. So we don't know remotely enough about the challenges that kind of populations have.
Yes, that's really true, and you will find that it's not just in genetics for ovarian cancer; it's really the genetics for Black, especially Black Africans. One of our most celebrated researchers, scientists, Professor Folake Olredino, who is based in the United States and works with the Mayo Clinic, has done a lot of work related to prostate cancer and the disparities. And whenever I speak to her, it's amazing how little there is. And so because she is doing all the work, she tends to get a lot of funding that helps to do even more. And they come to Nigeria and have this huge database now, all through that kind of effort. So this is really key, and one of the areas where we must focus on to close the care gap, as we're always saying. We've spoken about genetic testing in relation to ovarian cancer, and as highlighted by the Every Woman study. Mikis, can you tell us what other call to actions you would like to see amplified from the study that we need to get our policymakers and, like I said, even our scientists and researchers? What other call to actions can we make from this study?
Thank you. So the study was so broad in nature, so had various what we call cost categories. So we assessed the value of the contribution, for example, that caregivers make when it comes to them looking after ill women with ovarian cancer. So there's a huge number of people, and this has been a kind of policy issue that has come up quite a few times in my experience in the UK, for example, and no doubt in other high-income countries, and certainly gaining a lot more interest because there are people who are essentially dropping out of work so that they can look after ill women. So I think there's certainly a greater recognition of the role caregivers play when it comes to looking after ill women, but also other cancers as well, and indeed other conditions. Certainly, there's some initiatives that should be looked at when it comes to supporting women when they're returning to work. So again, our study looked at the productivity losses when it came to women who had been diagnosed with ovarian cancer, some of who return to work, some of who completely drop out of the workforce altogether. And of course, that has a knock-on effect in terms of the economy. And just one point on that specifically, when that's another area where there was a big difference between what was going on in high-income countries and what was going on in lower middle-income countries. There's certainly a greater recognition, at least officially, of the contribution that women play in kind of high-income countries, where it was not so apparent in some of the other countries that we looked at in kind of the middle and low-income bracket. So again, that tells you another story, and I think that's one of the things about this study. It's very much a conversation starter because there's so many different policy areas that you're looking at: productivity, caregiving, a return to work, the impact on the actual healthcare system is a huge subject in itself. So I think if you pick out these different things, I think there are policy responses for each of those different areas.
And if I could add to that, I think also because we've had the socioeconomic burden study and the Every Woman study, and 7 countries have both sets of data, so including Nigeria. So 7 countries have a set of data that's about the economic and societal impact cost of ovarian cancer, which incidentally is just for the 11 countries included in the socioeconomic burden study, it's $70 billion yearly. So it's a significant cost. But we have that data, and we can give that data set to Nigeria, to Kenya, to the US. But we can also give Nigeria, Kenya, the low and middle income countries that were in the Every Woman study, their patient experience data set as well. So now you're bringing together lived experience from cancer and the economic data in terms of the impact of ovarian cancer. And so I think together those are such powerful combination of insights. And so, you know, we feel very optimistic about the contribution that this work makes, just in terms of informed, evidence-driven, supported advocacy, and the case for investment in ovarian cancer, which is mentioned earlier about, you know, the people, the finance people, and that is, you really have to be in a position where you can make that moral case, but also support it with the financial business case as well.
Yeah, absolutely. And this is another part or another place where having a coalition comes into play. You have this amazing study. You have all the findings that have come out of it, and now you have the network that can help translate it into local action. And that is really the power of a group of organizations like yours. I know, like you've been mentioning Nigeria a lot, and for us in Nigeria, you have a real champion in Dr. Aisha Mustafa, who was one of the researchers and has been doing so much, going around and seeing all the policymakers to try to translate it into locally led action. And I'm sure she's involved in the second stage that you've spoken about, which I'd love to hear about soon. I'm sure we'll be hearing about it. And as a champion, you have champions in Kenya and different countries. We are here to push this narrative and to ensure that we get action at the national level. So it goes beyond just a paper. It's not just a paper, it's a unique paper. But we have that paper, and then now what do we do with it? And, if I think about the Lancet Commission, Women Power and Oncology, it was similar, and it highlighted a lot of these issues in a more general and broad perspective. The caregivers that you spoke about, especially in the African countries that are just overlooked and not really remunerated, and their time, the emotional and mental issues that they go through caring for loved ones that are going through a chronic illness like cancer is huge, and the need to come in and focus on them as well. Well, I'm glad that WHO has risen to that challenge, and lived experience is one of the areas where a lot of work is going on this year. So we've spoken a lot about the studies. Let's move away from that a bit as we round up. Let's hear about the World Ovarian Cancer Day. This is a big day, and I think through the efforts of the coalition, it's getting more and more prominence in the global health calendar. As we come up to the day, there are lots of activities that various organizations involved in cancer plan. What would be your advice, Clara? This is to you as the chief advocate now. How can we do more to amplify the World Ovarian Cancer Day and our key messages? What's the issue about ovarian cancer that makes it unheard, so to speak?
Thank you so much. It is such an important day and campaign for us. The coalition actually evolved out of World Ovarian Cancer Day, so we sort of came after the day, but the response to that first World Ovarian Cancer Day in 2013 was so positive, and there was so much enthusiasm and so much feedback that there and appetite to do more as a global network that actually the founders of the day created the coalition to take forward kind of broader program initiatives. But the day remains really near and dear to our hearts. We mark it every year on May 8th. We've had a campaign theme now for the last 3 years or 4 years, probably coming up, of No Woman Left Behind. That's a theme that's been really globally embraced. I think it works in all communities and cultures. We are able to create assets where it can be switched out. So no partner left behind, no family member left behind. So it also can be used in ways that resonate with what people's priorities are. My advice to individuals and organizations is just to get involved, to post something on the day. We will be focusing a lot on not just symptoms of ovarian cancer and asking people to share them more broadly, but also on highlighting and raising awareness, which is increasingly important, of the risk of developing ovarian cancer related to genetics and the importance of being aware of family history. So we have a lot of quizzes, we have a lot of educational posts, but what we're really asking people to do and organizations is on the day Please contribute. Use the
Hold on, Tara. Hold on. Sorry, just hold on. You're breaking. It's crackling, and the recording will not be. So we'll cut it off there. Let's let it settle. Is there something we should do? Is it mine or?
It might be we have a really bad storm happening, so it's possible that.
Okay. I think because it feels. Let's try again. Just as you were talking about getting involved in the day.
I'll just pick up from there. So what we really encourage individuals and organizations to do is just to get involved on the day. It's largely a social media campaign. We ask people to post what they've been doing. So a lot of our member organizations get buildings lit up in teal and bridges and iconic monuments. A lot of organizations do fun runs. A lot of organizations do, cupcake coffee mornings. And so share it. Just share that and add your voice to that global campaign. Use the hashtags No Woman Left Behind, ovarian cancer. That helps us measure the impact and the reach of the campaign. But it's gone from, in 2013, I think we estimated about 50,000 people worldwide participated in World Ovarian Cancer Day. Last year, that was 50 million people worldwide. So
wow,
it has taken up. And I think it's something that we can all, very easily just mark our commitment and our ambition for ovarian cancer and raise its profile globally. And I think, as you have said, it's a much kind of under-resourced disease, and it's just an opportunity to do something about that on the day.
Indeed, and I hope that's amazing figures, having all those engagements, and you really do have a lot of champions there. People like Lisa Road, Ranjit, Ebe, that are all parts of the ovarian cancer family that have seen really amplifying the cause. There tends to be, should I say, not as much connection between advocacy and the technical side, although, as I mentioned, we're doing better in including patients with lived experience, caregivers, advocates that are creating education and awareness. But Mikis, what can partners and the scientists and the research end of things, what can they do around World Ovarian Cancer Day in their own way to really get involved? Instead, it's a social media campaign, or there's more emphasis on social media. How can the partners also get involved?
Well, I think in the past, I think Clara is a better place to answer this question, but in the past, I think there's more, I suppose, in-person activity that people do. So if I kind of mentioned sort of lighting up buildings, doing things within their own laboratories in terms of getting people enthused about the day, sharing things that we are doing. We produce a lot of online tools that people can use on their own social media channels, taking photographs, uploading them, really getting people to talk about ovarian cancer in a way that it hasn't been talked about. The other thing is, just from my own kind of background as working with politicians, a lot of local partners, what they do is they will contact kind of politicians and get them to raise questions in Parliament, for example. If you get a question from a friendly politician who can ask a question of a minister, at least you're getting something there on the record, because they're obliged to respond to something and say, right, this is what we're doing about ovarian cancer. This is what we're doing to tackle the challenges. So there's lots of different things that you could, certainly with the journalists as well, are equally valuable.
I deliberately put that question to you so that we could together. Was there any other thing you would like to highlight, Clara, about the coalition and the work you're doing, or any message?
I think I feel it's a very exciting time for ovarian cancer and for the coalition, and I think globally for our advocacy organizations. We clearly all the world's in a bit of turmoil and there's, a lot of uncertainty. But the one thing I always remain certain of is just the commitment and a focus on improving outcomes for women with ovarian cancer, improving survival, improving quality of life. And Zainab, we really wanted to thank you personally for your support for the cause, for being the best ambassador an organization could have, for your patience and your, just really helpful contributions. We know how busy you are, so it's.
Thank you. Thank you. I try to do my best to make sure that we amplify the cause and create as much awareness. And that's really why the UICC hat is so amazing, working on a global level. And like you so rightly said, it's not about global initiatives and having this coalition at the world and so. What are we doing at national level? How do we translate those findings and the initiatives to local action? And that's where we need to have foot soldiers, and that's what I try to be.
Thank you.
I want to use the opportunity, just because we're around the Ovarian Cancer Day, to talk about the symptoms of ovarian cancer. Why is it missed, and what are those symptoms which we say are not common? We say it's not commonly, diagnosed on time, but they are indeed quite common. I think they're just so common that no one thinks of them as an issue or related to cancer. Tell us about the symptoms of ovarian cancer and the diagnosis.
Absolutely. So the symptoms, you're quite right. The challenge with ovarian cancer is there's no screening tool. So we really are reliant on women to understand, identify when they're having an issue, and healthcare professionals to take that forward. So the symptoms are bloating, so bloating and abdominal pain or back pain. Sometimes people feel that they get full very quickly, so they're hungry, but they can't eat a lot. Changes in your bathroom habits. So how often you have to go to pee, how, your bowel habits. So those things, and often what happens, and it's understandable that women will take their concerns. We know women do experience symptoms and do go see their healthcare professional, but they often will get misdiagnosed or not diagnosed or not referred to the diagnostic pathway for extended periods of time. So it's really important that we promote awareness of the symptoms to women and to healthcare professionals. And the key message is, it isn't if you've experienced one of these or a combination once or twice. It's when you have these symptoms and they're persistent and they don't respond to the anti-acid that your, pharmacist suggests that you take, or it's not irritable bowel syndrome, it's not responding. It's, so these symptoms are persistent, and that it's really important. And the diagnostics for ovarian cancer are complicated. It's a blood test, CA-125, vaginal ultrasound, and moving on from there. So it's not that, they're not costly procedures or interventions in terms of diagnostics, but the challenge is patients and clinicians knowing when to act and act quickly to really, in most cases, rule out something like ovarian cancer. But for those, the minority of women who do have ovarian cancer, it's really important that they get diagnosed as quickly as possible.
Great. So just abdominal symptoms like bloating, feeling gastrointestinal, feeling of fullness, frequency, urination, or even a change in bowel habits. These are things that, put in context, we should be more aware of and seek medical attention for. Would you like to say a final word, Mikis, before we round up? Either on the World Ovarian Cancer Day, the symptoms, or even a parting shot from the study, the socioeconomic impact.
No, I'd just like to repeat something that we've kind of talked about throughout the call, which is really when you combine these two studies that the coalition has been working on for a number of years now. So the Everyone study and the socioeconomic burden study, I think it really gives a very solid, strong evidence base that I think advocates, and we would encourage everybody really from the community to use the information. It's not just about the 11 countries in the socioeconomic burden study or the 22 in the Everyone study. A lot of the themes will be relevant to all countries. In fact, all of them will apply to all the countries. So, I would encourage people to use this, because we know policymakers always say to you, well, where's the evidence for what you're calling for? And we've got these two very, very strong studies as evidence. So I would just say use them as much as possible.
I really appreciate your time. But before you go, you have to do one last activity for me. I would like each of you to stay with as much, passion and energy as you can muster. You can see I'm moving my hands here. So I'd like you to stay united against cancer. We'll start with you, Clara.
United against cancer.
United against cancer.
Don't forget to like, comment, share, and subscribe to Oncodaily on YouTube. Hit the bell icon to stay updated.